Welcome, everyone. Hey, this podcast is a podcast that explores various aspects of addiction, potentially focusing on personal stories of recovery, scientific perspective, societal impacts, or related topics. This podcast often features discussions with experts who we're going to have on the show today, individuals in recovery, therapists, and advocates to offer insights and support to those affected by addiction or seeking more information about it. And today we are going to be talking about mental health with our guest, Rob. Rob holds a bachelor's degree in psychology from the University of Utah and a master's degree in mental health counseling from the University of Phoenix. He has worked in a variety of mental health settings during his career, including residential treatment, outpatient treatment, and administration. Rob is currently the executive director of NAMI Utah, National Alliance of Mental Illness Utah. Rob is also a past co-chair and current member of the executive committee of the Salt Lake Valley Coalition to End Homelessness. Rob, in his spare time, works as a master scuba diver, which I would have never known, certified by the Professional Association of Diving Instructors, and helps his wife run their scuba diving business. He has 3 children, and of course, he lives here in Salt Lake. Welcome to another episode of The Other Side of Addiction. I am your host, Al Richards. Rob, thank you so much for taking time out of your busy day to be with us.
Thanks for having me. I appreciate it.
What the heck got you in the direction of going into a career to deal with mental health? Is that that's just not something you wake up one day and go, you know what, this is the direction I'm going. Is this correct?
I think it's similar to a lot of folks, and you probably experienced this. When you talk to folks who do this work, they all have a story. They had a mental health condition, they've got a family member, a friend, they saw it, et cetera, et cetera. And I'm no different. I have family experiences with mental health conditions, with substance use disorders, et cetera. And frankly, in my kind of early career doing some other stuff, and I thought, as I started doing some work in this field and working with people who've experienced substance use disorders, experienced serious mental health conditions, frankly, I liked the work better. I liked working with those folks. I think they have, I think we can learn from everyone we encounter. And I don't know. I'll lump myself in here. I think we're just more interesting, frankly. And that's kind of what got me on the path, right? And I'll tell you some I think critical things that shaped it. When I started, I worked at then Valley Mental Health, right? And just doing kind of case management stuff and working with folks. Again, just super interesting stories and just resilience. Like we meet folks who face things that most people could not handle, and our folks do. And I kind of love that. And so even when we face tremendous challenges, if you listen to the folks you work with, you learn stuff. I learn things every day, and I've been doing this over 20 years. So
yeah,
kind of what pointed me.
I love what you said about individuals that have gone through stuff in their life that really the majority of us probably would not be able to handle. And I would have to piggyback off that and say, yeah, absolutely, you're correct. Because all the people that I have had on this show and to listen to their stories, gosh, there are times, Rob, I've scratched my head and going, my gosh, would I be able to handle something like that? Or, no wonder you fell into some sort of an addiction, because you just wanted to numb yourself completely away of everything that was happening in your life. And some are choices that they have made, of course, and others wasn't quite their choice. It was just kind of where life kind of plopped them, right?
Yeah.
And I have to say, I agree. These are the people that I have met in the recovery community are some of the most inspirational, life-loving individuals that I've ever met my whole life. And I've got 60 years now, thank goodness, on this planet. And I've had friends, but not friends quite like what I have now. And it's these type of people that have opened my eyes to go, this is how we need to look at life. And they've educated me a ton.
Yeah, agreed. And you know, I think the other piece that you learn along this journey, and I think it's something that is probably missing in a large part of society, perhaps, is you kind of learn to go into this with the assumption that whomever you're working with, and even including yourself, we're all doing the very best we can in this moment with what we have. Because that's an interesting thing you say about the choice of folks. And I've had lots of discussions about this. And you also said something pretty powerful early on. Sometimes the need to escape by any means for any period of time is the overwhelming and overriding force in someone's life who has experienced trauma and abuse and neglect and just horrific things that we've all heard, folks. And I had one person I was working with many years ago, an older woman, and by all rights should not have been alive, but just tough as nails, and you know, lots of folks found her difficult to work with, was very strong-willed, et cetera, et cetera. And she and I were talking one time, and she said, you know, you people don't understand. If I can escape feeling like I do for 2 minutes, I will do almost anything to escape this feeling. And that's powerful. If we listen to that and realize that, you know, it's not the hierarchy of needs that we were taught in school. It's, I simply cannot feel this way all the time. And if we can acknowledge that, you know, the behaviors that sometimes we say, oh, that was your choice, really in my mind aren't. It may be a choice, but it's not a great choice. Like, and I'll jump a little bit. We hear fairly often that people who are experiencing homelessness, they've chose to be homeless. Well, but what are the other choices? Arrest, incarceration, a very crowded, you know, facility that maybe with their mental health conditions doesn't work, or just any number of things. The choices aren't great. It's not live safely in a comfortable home with lots of food and loved ones around me, or being on the street. That's not the choice. That's never the choice. And so if we can go into this assuming that everyone is doing the very best they can right now, hey, it makes it easier for us working with folks.
Yeah.
You know, I mean, think about time that we've worked with our fellow coworkers and they were getting really frustrated. This guy, he's not doing what I tell him, and he's doing all this stuff. Well, it's not in the grand scheme, it's not about you. It's about that person figuring out a couple of things. And one is, can they trust you? Because if all they have to do is not do what you tell them to do for you to reject them, that's kind of what folks that we work with, that's kind of what they're used to. Oh, I've been rejected because I don't fit.
Yeah.
So I think it's a good opportunity. I don't know. I just think, and we see it all the time. We see laws passed. Just finished with the legislative session, and you know, we see statute that really kind of rejects, in some ways, a lot of the folks that we work with. And I think it's a great opportunity to, if nothing else, let them know, hey, we see you, we hear you. We recognize that you're a person and you deserve things that every person deserves. And that can be pretty powerful. It can be very hard for folks we work with because they don't necessarily trust that.
Yeah,
with good reason, right?
absolutely. Yeah, they've been pushed in the corner way too many times, right? So
Yeah,
they're gonna protect themselves. I mean, that's our subconscious national state, right?
yeah,
It's going to protect ourselves whether it believes it's real or not, because it doesn't know.
yeah.
So it's gonna protect us, and I have issues sometimes with the way these laws are passed, and it may be because of someone that had a bad experience and now they're all gung ho and no, this isn't going to happen because this is what happened to me.
Yeah.
And I would really like to see something in the future to where before a law is passed, these people who sit there and determine what law we're going to have and which ones we are not, why don't they go and learn a little bit more about the subject, right? Instead of just going off of, and there are people probably like yourself, and I know a lot of people from USARA who go up
Oh
there
yeah.
and Clean Slate Utah, and they go up there and they plead their case, and they're doing the very best they can. And these are good, hardworking individuals who have huge hearts. They care, they know because they've lived it.
Yep.
However, let's get some people come down off their high horse. And I'm just going to put it that way, come off their high horse and learn about these individuals. Because I was one 3 years ago, all my life up until 3 years ago, that went downtown, saw the unsheltered, saw the addicts down there, and I'd make my comments just like what you said, right? They
Mm,
probably choose to be here, and
sure.
what the hell's their issue? And I can't believe they're being this way. And now that I have put myself in this community and have heard the stories that I've heard,
Yeah.
see, the emotions already just kicked in. Now I go downtown and I see these individuals, and the first thing that pops in my head is, I'd like to know what their story is.
Hmm.
What has happened in their life to put them in this situation? Because something put,
Hmm.
something happened. And a lot of these individuals that I've had on as guests have come from those positions, right?
Yeah.
And
Yeah.
just so happen, just like this lady that you spoke about, who, if she could just not feel the way she's feeling just for 2 minutes, she'll do just about anything.
Yeah.
These individuals somehow, some way, with God's help and other individuals, as well as their own determination too, to want to get help and get themselves well and on a better track, have made it, which goes to prove it's possible. It definitely is
Yeah.
possible. However, there needs to be more help out there for them to make it even more possible, if that makes sense.
Oh yeah. Yeah. It's easy to say, oh, it's their fault. But if you look at, you know, things like affordable housing, things like the ease of access of drugs on the street, of the proliferation of trauma experiences that people have had. Yeah, there's all kinds of things that kind of feed into it. And I'm always very aware of when we're, blaming the individual versus looking at the system structure. Sure, the individual is part of that, but are there the needed resources? Do those individuals have the opportunities they need? To the extent that even some of the services and support that like the system, like we provide, right? If that doesn't meet the needs of that individual, and I hinted a little bit to someone experiencing homelessness for whom a kind of densely crowded uh, resource center maybe isn't the right intervention for that person, etc. Where I think we have the opportunity is to listen to people, to really evaluate what intervention is going to work for them. And I have to say, we've in my mind, sort of stumbled upon some things over the last few years. And one I'll point to is during the COVID years, our community was able to develop non-congregate emergency shelter. So where folks had like a room, instead of a cot, they had a room for certain individuals, high risk, et cetera, et cetera. And people loved it. It was great. And they were able to then kind of settle and then access additional resources, treatment and case management and applying for benefits and all those things that are so hard to do when you're in a state of crisis.
Yeah.
So there is some effort to do those pieces, because when you've been burned so many times by really a system that is supposed to be designed to meet my needs, but it's never really done that, it's hard for folks to not only survive, but then to get up the strength to once again put themselves in a position where they may not receive the resources and support they need. And I'll give you sort of a stark example. So I've been involved in the homeless point in time counts for 8 or 9 years now. And we go out in early January or late January, early in the morning, and we locate people experiencing homelessness on the street. We have lots of volunteers and we train them, and we utilize information from outreach teams and actually local law enforcement. They usually know where folks are camping and such. And so we'll go out and we interview these folks, short interview. It's like 10 questions. We have to do this for some of the HUD funding we do. But one of the reasons we do it is because it's an infusion or an increase of outreach. Because if we go to folks that don't routinely see outreach workers and we go and we say, we're out here to talk to you, we get pretty good response. Folks want to talk to us and they are interested in some of the potential resources that are available. But a few years back, we were out and we encountered an individual, and he said, you guys have surveyed me out here for the last 2 years and nothing's changed. Why the hell why should I work with you? And he was dead right. He was right. Like, why do we keep coming out here, finding you out here? Why aren't we able to help provide the resources that you need to get in a safe, stable space so that you can move forward? So, we need to listen to folks too, that what we've offered doesn't always work for everyone. And we have to be willing to say, how can we do it? How can we change it? What's the intervention that will work? Because, you get, especially, the powers that be, well, they just need to do this and then they'll be fine. And they lump everybody together and they say, here's the intervention you get. And if you don't do it, then it's your fault. Yeah, we know it's much more complicated than that. And it's that trauma piece. I mean, I've been studying trauma for years. And people who've experienced significant trauma, they're in a different state. I mean, they look at situations differently, and rightly so, because they've had a different experience. Yeah. And we have to honor that and say, okay, we acknowledge that you've been in these situations, and we're going to do the best we can to provide an intervention that works for you. And again, it's just like checking the judgment at the door. At the end of the day, for me, mostly I don't care why someone got in a situation they're in. It's what do we need to do to get out of it? What do you as the person see as the solution? And let's see if we can support that. And we see that often with mental health. Folks have been told, well, you just need to do this, and then you should be okay. And if it doesn't work, then they're just told, well, you just didn't do it right. And that, and that kind of gets to, I always bring up this idea of customer service. Like, why aren't, in my mind, if I'm providing any kind of service, customer service, like client satisfaction should be number one. Like, when folks come to my services, are they satisfied? And, like as far as NAMI is concerned, when we survey folks about their experience with a support group or an education class or something, it's the number one thing. People were not satisfied. A lot of times we'll follow up and ask questions. What could we have done better? Or it might be in the survey. Oh, you guys should have done this. And we'll always follow up and say, gosh, here's what we're going to try. Or, would you be willing to talk to us and tell us a little bit more about all that stuff? Because at the end of the day, if someone doesn't feel good about an intervention, it wasn't a very good intervention, and it may take, and that gets tricky, right? And that's part of the challenge of some of these laws that are passed. Like, oh, the judge is going to tell you have to go to treatment because you've been in and out of treatment. Well, we know that sometimes treatment takes a while. And what are the other supportive services offered to that individual? Do they have safe, stable housing? Do they have, adequate food and a good community and all of those other pieces that help treatment work? So I think it's something to think about. What is the client experience? What is the person we're working with? Is it good or not? And, unfortunately, we here at NAMI, we hear a lot of stories of folks accessing services, clinical services, and not being very satisfied with that.
Yeah.
And that's troubling to me. And I tell that to everyone who will listen that, hey, we should be more concerned about this idea of customer service, because Target is, Chick-fil-A is, all of they care about what the customer thinks. And, folks we work with are customers.
Yeah.
Regardless of who's paying. Like, I don't care if the state's paying or the federal government, Medicaid, whatever. They're still customers. They're still seeking a service.
Rob, I agree with everything that you're saying. And I'm not saying it just because I'm agreeing with you, because if I didn't, I would say that I didn't.
Yeah, yeah.
The difference between Target and Chick-fil-A, the people that we work with or that we are around, they're not looked at as individuals. And you said that earlier in the show. They're not looked at as individuals. These people have family that love them, that are missing them, who
Yeah.
have kids that wish that they were around, or a spouse, or a mom or a dad or an aunt and uncle, right? These are, you said it a couple times, these are human beings. And how quick we are to go, well, we gave you this, and if it didn't work, then guess what? We're passing the broken system onto them. It's your fault, not ours.
Mhm.
So we're not taking accountability for our own BS, really is
Yeah.
what it is. That's how I see it, right? And again, I think it's to where more individuals need to get out and experience these individuals and really, really listen to them. You cannot be a good psychiatrist or a therapist or a coach, whatever it may be, a sponsor, unless you are really listening to what this person has to say, right? And
Yeah.
yes, there's so much red tape. Our hands get tied so many different ways with all kinds of colors of tape, not just red, right? There's always a reason why. My question is, why is there so many reasons why?
Yeah.
I mean, with the technology and the science we have with so many things nowadays, and the smarts that is out there, you're telling me we can't come up with a better system because the system we have has been broken for many, many years. It's a revolving door. I know someone who has been looking for a job for over 7 months and
Yeah.
cannot find a job because of the record, because of their past record,
Yeah.
right? So they're being judged because of a record. Oh, no, can't have this person because there's something wrong with them. And I like to tell people, look in the freaking mirror. What's wrong with you? Because I'm sure if you really stared long enough, you'd find some things, right? We all have those skeletons in our closet, and we're all doing our best, like you said. We're all doing our
Yeah.
best to
Yeah.
make it through this thing we call life. And
Yeah.
sometimes we need help to get us past a certain threshold?
I would a couple of things. So one, I don't think it takes us that long in the mirror to know. I think we carry it. I think folks carry it. They know what
Hmm.
their deficits are. But the other interesting thing is we all need help all the time, like all the time. We have our support system around us and we lean on them even when we're not sure. We come home and we're grumping about work. We're leaning on our support system. If we we do it all the time. And so this weird thing about, oh, you got to do it yourself, the whole, sure, I can work as, I can do as much as I can in the moment, but I'm still going to need help. Like this whole individualistic and all that, that's not how we live. And I would say too, so the second piece is, why is it so complicated? And this is something that really frustrates me, is it's kind of because it's been that way for a long time. And so we just continue. And I think a little subcategory to that is we've really tried to make the like mental health substance use treatment, we've tried to make it like a medical model, but we haven't really, but not really. Like haven't integrated it. We haven't made it easy to access. Most people don't know how to access mental health or substance use treatment. They go to their primary care doctor who doesn't really know anything, or they go to the ER and are told that's not our problem. And so we've kind of, for probably since the 80s, we've sort of built the system that's never really responded very well to people. And then you couple some other things that are happening, with affordable housing and all that stuff. And it makes it really hard for folks to get the care they need. And then underlying all of this, and a lot of what we've been talking about, are the descriptors of stigma. Like if I break my arm, I have no problem going to the doc, going to the ER. Oh, I got my broken arm. And they're going to go, okay, here's treatment. Bing, bing, bing. Great. They don't make me feel crummy. They just say, all right, here you go. Take care of it. Blah, blah, blah. Pretty easy. If I go to the doc and I say, man, I can't get out of bed. I'm sad all the time. I'm crying. A lot of times, especially if you're a woman, you get told, oh, just, you're just going through a thing. Just get over it. Right? Like that's kind of what we get. Or here's some pills.
Yeah.
And that could be part of a treatment intervention. But there are other interventions that aren't routinely provided. And I actually had this conversation yesterday with someone who was asking me. He was represented. He kind of worked in rural community, and his question was around, people show up at the ERs in these rural communities and they have mental health conditions and we can't handle it. What do we do? And it's an interesting question because people have been showing up to ERs for mental health conditions for 40 or 50 years or more, probably as long as ERs have existed, because that's an identifiable treatment provider. I'm having an issue. I'm going to go to the identified treatment provider. And for some reason, over the last 40, 50 or more years, we haven't integrated a behavioral health care plan in these settings. We just keep saying no. And that's part of the issue as well. We hear no so often. Nope, can't do that. Can't do that. It's kind of the answer to your question. Why haven't we integrated things better? Why haven't we utilized technology better? Why haven't we done some things better? Well, because we hear no. No, I'm not going to pay for that. No, I'm not going to change my clinic in that way. So one of the things that's been kind of my thing is, how can we say yes as often as possible? And I'll give you a little story. So I was part of the development of the Volunteers of America Homeless Youth Resource Center. They're on 888 South and 4th West. or something a number of years ago, and I was part of the team that put it together. And as we were, training the team and getting ready to open and such, I said that to the group. I said, let's what we're going to try and do here is say yes as much as possible. And a couple of them laughed at me. They're like, well, it's just going to be a madhouse then, because you're not going to have any control. I'm like, I beg to differ. If we say yes as much as possible, we can still have boundaries. We can still say, ugh, for your safety as well as everyone else's safety, we can't really have that here. So here's what we're going to do. It's not saying that we don't have boundaries and that we don't have rules. It's saying that as much as we can, we're going to say yes. And really, and even when someone, because it was usually around safety, if someone was threatening or they're really, and they couldn't, come to an agreement about something and they were really angry, and what we would say yes to is, look, we are going to ask you to leave, but we want you to come back tomorrow and let's talk. Unless they would talk then, and then we'd do it right then. But if they're like, if you guys, then we'd be like, all right, come back tomorrow. During my tenure, we didn't exit anyone for longer than a day or two because we wanted to talk to them. Now, if they came back and they were still, F you, you guys don't help me and all that kind of stuff, well, okay, we respect that. But, so we're going to maintain your safety as well as other folks' safety. Come back tomorrow, whatever. But we're trying to say yes. And again, our folks are not used to that. And we do that at NAMI too. We have folks who, maybe they've never really learned how to be in a group, like a support group. So they kind of dominate. And we have all kinds of stuff. We train them to be good group members because we want them to understand that the group is there to support them. But maybe there's a couple of things we can do. So we don't kick them out. We just say, hey, let's, like we do a lot on Zoom, and we'll have a little breakout room and we'll talk to them and be like, hey, try this. And it's successful. So it's, in the face of our folks hearing no all the time, everywhere. If we could just embed that, and I think we're getting better. I think our programs are much more trauma informed. They're not perfect, but they're better. They're better at saying yes. And that helps people, because if all you hear is no, you give up. Like you've been trained. Like, nope, you hear no enough. Of course, folks are going to feel like giving up. But it's like you said before, even in the face of folks hearing no for 50 years, 60 years, they're still like, I'm going to keep going. There's a part of me that you've not broken yet. And that's the part that I think is so, it's so powerful. Because they're still going.
Yeah.
And it's cool. And I like being part of that because it energizes me as well. So,
Rob, this concept about saying yes, and this is how I'm picturing it.
yeah.
You say yes enough. Someone comes in your door, whatever their issue is, you say yes. You're able to help them, right? This one yes changes this person's life, right? I mean, no matter how big or how tiny it is,
Totally.
because one little teeny tiny amount of love towards somebody or kindness can change a life in such a huge way, right?
Yeah.
You say yes. This individual starts working on themselves and they start doing better just because of this yes. Now all of a sudden they're in a position like yourself. And then that could also be the person that starts these mental facilities in ERs because they have figured out a way, right? So between all this, all the bad stuff that is out there and all the no's that these individuals get, some yeses, man, could change the world for so many of us, right? Because somebody who opened up NAMI, there's a
Yeah.
reason behind it, right? They suffered with it, or they had family
Yep.
members, just like what you said, how you got into the industry,
Yep.
right? You've got people who we are big supporters of, like the Other Side Academy, downtown Salt Lake, right?
Yep.
Dave DeRocher lived it. He went through it.
Yeah.
He understands, right?
Yep.
And they're changing people's lives. You've got people like Destinina Garcia with Clean Slate Utah, who
Hmm.
got pulled in off the streets and was given an opportunity, and she ran with that opportunity. And now she's out there helping hundreds of other individuals get their lives back on track. So
Yep.
these yeses
Yeah.
can make such huge gains in our community. And again, that's where I get frustrated is whoever's making these flippin' laws,
Yeah.
all they see, and I'm, I don't, well, maybe I don't need to say it that way because I don't know how they're looking at it.
Okay.
They're not seeing an individual. That's all. I'm just going to put it that way. They are not seeing an individual. And when we
Yeah.
start seeing people as individuals, and just like ourselves, right?
Yeah.
That's until then, we're going to continue to struggle with the same things over and over and over. And to have systems in place like what you're talking about,
Yeah.
you know, I went to a credit union a couple years ago to go make a payment, and I come out, and my wife at the time was out there in the parking lot having a cigarette, and she's talking to some guy,
Hmm.
and he's got his little bag with him, and I'm like, what the heck? And I go out there, and she goes, hey, meet so and so. And I meet this gentleman, I shake his hand, and he introduces himself. He had just gotten out of prison.
Okay.
I mean, literally like 3 hours before being right there, right?
Okay.
And I says, really? And he starts sharing his story. He's like, I don't know where to go. Well, he goes, I know where to go, and he two places to go. But if I make the first choice, I'm going to end up being back in prison. I don't want to go to that area. However,
Okay.
I know of another area where I believe I have somebody that can help me till I
Hmm.
can get some things figured out on which direction I need to go. But
Yeah.
he's like, I don't know which bus gets me there because I've been inside for so long. I don't have a clue. I don't have a phone. I don't have a
Yep.
cell phone, right? So my wife at the time, she did not have a license because she lost her license due to driving under the influence, right? She knows the bus schedule like the back of her hand.
Okay.
So she goes, we will be willing to take you to this bus station or this bus
Hmm.
stop. All you have to do is get on this bus, and it will take you that direction. Just, you'll recognize the area, hopefully.
Yeah.
That man, now I'm letting this guy who is 3 times my size get in my vehicle with me and my wife,
Yeah.
and and just got out of prison 3 hours ago because I could see the desperation in that man's eyes.
Yeah.
Literally, he's like, I cannot go that way. I know what my old self will do. It'll come back, and I don't want that to happen. I want to make a
Yeah.
difference. And we did. He jumped in the truck, and we
Yeah.
took him down to that bus stop, which was only a few miles away. It wasn't very
Yeah.
far.
Yeah.
That man thanked us. I mean, my wife, is being a smoker, knew he was a smoker. I think she gave him like 4 or 5 extra cigarettes, so he had some cigarettes for him to smoke, and that man was so thankful.
Yeah.
And to be able to have resources like what you're talking about for women who are just getting off the streets,
Yep.
people who are just getting out of recovery and have burned so many bridges, their families don't yet trust them, right? Something they got to build back. Where do they go?
Yeah. Yeah.
Someone who is fighting trauma and some mental illnesses, and have maybe been in a facility for a certain amount of time, and I'm just throwing this out there. Let's say the insurance doesn't want to cover it anymore. So where do they go from there?
Yeah.
Right? Why do we continue to waste this time? And I really don't want to say wasted time because you still get things from it, however, right? But we're not continuing the resources
Yeah.
that individuals need. And I went to I went to a neighborhood protest a few years ago. A sober living was moving into this neighborhood. And Rob, I tell you what, I was just in awe. It was literally like the 1930 something movie of Frankenstein, where these people had their torches, their pitchforks, throwing a fit that this woman sober living was going to move in their neighborhood. And I had a couple next to me where this lady worked at, I think it's AP&P. I think it's
Okay.
the AP&P.
Yeah, yeah.
And right next to me, and she's yelling, and she goes, I worked at AP&P, and I've seen what kind of individuals come through these doors. And I looked at her and I says, or no, these kind of people. That's how she put it.
Yeah,
Go
yeah,
through this door. And I looked at her and I says, these kind of people, I says, you better watch what the hell you're saying, because these kind of people, one of them was my wife, right? I mean, I was getting defensive. I'm getting pissed, but
yeah,
that's how she
yeah.
saw it. So she worked at a place where basically she just saw nobody's walking in the door. And that was
And they knew,
frustrating.
and they knew it. We see that all the time. The folks who should have compassion and empathy for these individuals, because that's what they need, like you showed to the gentleman who needed the ride to the bus stop, he needed a sense of community, and you could sense that, and he got that. But when folks behave that way, when they have these protests and such, they're not talking about individuals. Gets back to what you said. They're not talking about individuals anymore. They're talking about those people. They're othering people. They've never talked to anyone. And here's the fun part, is it is incredibly likely that many of those folks in that room have someone with a substance use disorder or a mental health condition in their pretty immediate family.
Yeah.
I see it all the time. Like I am not sure I have ever just kind of had a random conversation with someone, because I always tell them I'm with NAMI and what I do, because I like doing that. And then it's almost 100%. Oh, I have this struggle. Oh, my daughter has this struggle. Oh, my dad, my whatever. Literally almost anyone, including folks up on the Hill. When I talk to legislators, any of them have shared stories with me about why it's important. And so it's interesting, and I will tell you that unfortunately, those kind of meetings continue. Had one about a month ago in Mill Creek, where one of the providers is trying to open a supportive facility, and what ended up, and it's interesting because at first they were proposing a men's facility, about 60 beds, kind of, treatment, et cetera, et cetera. What ended up happening through a couple of fairly prominent neighborhood members, they said you can have a women's facility, but no men's facility. Kind of funny to me, because I know that some of the realities of operating some of the facilities, et cetera. So that was kind of an interesting thing. But the cool part was that there were a lot of neighbors saying, yes, we can do this. They are people, they are members of our community. Absolutely, let's do this. And so I think we have more of both. I think we have more othering, but I also think we have more people saying, yeah, like I think we can do this. And the funny thing, so couple of examples. So one is you probably know this, there are sober living homes all across the state, and especially in the county. They're everywhere. There's literally hundreds of them. Most folks have no idea, because it's just people in your neighborhood. They're just people in your neighborhood. They're hanging out, they're doing their thing. Like you mentioned, they're trying to live their lives, doing whatever they can. They're just living. They're just people. Let's see, the other one. So years and years ago, speaking of othering folks, it's when, I think it was Salt Lake County and the Collective Impact Group, they were working to shift the way we provided homeless services. They wanted to get rid of the big shelter downtown, and they wanted to locate a couple. That's when they made that shift and went from the big road home to the facilities, the resource centers. And so I was part of the group that met with communities. So we had a meeting in West Valley, because West Valley was one of the locations that was kind of on the table. They had some land, and hey, we might be able to put a resource center out here. And the folks were respectful and curious and had great questions and were respectful. Like when people were speaking, they were listening, and they had great questions and expressed concerns. Gosh, I'm not sure, I'm worried about, law enforcement and all kinds of very appropriate. It was a really great meeting. It was there at the multicultural center there on just off Redwood Road. It was great. I mean, I met some really, really cool people, and people who were, concerned, like, gosh, I don't have much. And I worry, I just worry what's going to happen to us, or are our needs going to be taken into consideration? And then so I may make some enemies here, but and then juxtaposing that to the meeting in Draper, because at the time the Draper mayor had said, I've got some property. Let's take a look at it, because we might be able to do it. Boy, talk about pitchforks, and we're not having those people. We heard things like, we hate homeless people. We're not letting this in our neighborhood. We're not going to do this. But what was interesting is, while they were demanding to speak to the mayor in the auditorium, and we demand, and they were pretty rude, a handful of folks stayed outside where we were, because we were giving like information about the project. And this handful of folks were like, we could totally do this. They volunteered at the prison. They donated, their time, et cetera, et cetera. And this handful of folks were like, we can totally do this. We have the resources, we have the law enforcement, we have the land, we have the resources, we can do this. And it was really refreshing to see that little group of people, but unfortunately, kind of mob rule, and they were pretty hurtful. And I suspect that most of those folks had never talked to an individual in such a circumstance. Because when you do, you realize they're just people. When I hear people, oh, I'm so afraid, oh, my safety, oh, public safety. And what I say to that is, say hello. Someone asks you for money, give them money or don't. It's up to you. Like, if you don't want to, say, gosh, I don't have any cash on me, whatever, but gosh, have a good day, take care of yourself. I always tell people to take care of themselves. Or I even ask them, are you taking care of yourself? I don't tell them what to do. I don't tell them about any resources, because those guys mostly know exactly what they can and can't do, and what they want and don't want to do. So I just talk to them. Hey, how's it going?
Yeah.
Oh, and and maybe it's because I'm an old white dude, but I've not been threatened by anyone on the street. Like, hey, how's it going? You okay? And I don't know. They're people.
With you just saying that, Rob, something just flashed back. So what was it? I guess, I don't know, maybe 3 years ago. I'm not even for sure. Whenever the last December was, to go downtown and see the temple lights during Christmas. I don't know
Okay.
if that's been 3 or 4
Oh,
years ago.
yeah,
So
yeah. I guess that was pre-COVID, right?
yeah. So it was a while. Well,
Okay.
one thing that my daughter and son-in-law have done, I think, so well with the grandkids, their kids, is to teach them that the holidays is not about receiving. It's about giving and caring for others, right?
Okay.
And I love that they're doing this. So here it is. The last year we're going to have Christmas lights. So we plan this family event.
Mhm.
We're going to go downtown. We're going to go see the lights. My daughter goes out and buys, I don't know how many dollars worth of $5 McDonald's gift cards.
Oh, cool.
Okay. So our plan was to go down there, look at the lights, and then usually outside the temple during that time, you have a lot of the unsheltered people that are there, right?
Yeah.
And they're asking for money or different things and help. And so our plan was when we got done, we were going to go and talk to these people and give them a gift card so they could go
Hmm.
get a meal, right?
Hmm.
Because back then you could
You
get
could get a
somewhat of a
meal.
meal for $5. It's like
Yeah.
20
Yeah.
bucks now, right?
Yeah. Yeah.
So it was raining. So we made our trip through there really quick, and we come out and there's only one man. And we ran into this gentleman
Mm.
on the way to get in our vehicle.
Okay.
And my daughter gives him a gift card, and he's very great. Thank you
Hmm.
so much. He's very happy that he's getting a gift because we know he can't. I guess maybe he could trade it for drugs if he wanted to, but he's got a meal, right?
Doesn't
Again,
matter.
it's his choice, right? It's
Yeah.
his choice.
Yeah.
So my son-in-law goes, you know what? I know where we can go. So we all pile up in the van
Mm.
and we head off down the road and we pull over to this place. And my son-in-law goes, guys, me and Lainey, which is my oldest granddaughter, we are going to go. Why don't the rest of you stay in the vehicle? Because it's raining. There's no reason for all of us to go. So they grab the rest of these gift cards and they get out. And I don't know how long they're gone.
Mm.
Me and the other kids and my daughter were all in the van and we're talking, having conversation. And pretty soon here they come back.
Mm.
And I get emotional thinking about this because I can still see my granddaughter's facial expressions. She gets in the van and my daughter notices it right away. And she goes, "Are you okay? How was it for you?" Who? My granddaughter starts crying. And she's, I don't know, 9 at the time, I guess, 8 or 9. And she's like, "Sweetie, are you okay?" And she goes, "Mom, these people were so nice. Everyone said thank you. Everyone was so grateful." And she's crying because she's like, "Why don't they have a home?"
Yep.
So you've got this young lady who sees the kindness in these individuals that she's never met, probably will never meet again. And she's trying to put the pieces together, right?
Mm.
Of going, we're handing you a gift card so you can eat, where I can go home and get right in the refrigerator. And I have a warm, a roof over my head so I can get out of the rain. And here you are huddled up in these areas under buildings where awnings are trying to keep the rain off of you. And she goes, they are just people. So
Yeah.
she saw it as a young girl, but us as adults, we're so freaking blind. So, and I
You
just
know,
wanted to share that because when you said it, that
yeah.
popped into my head immediately.
Yeah. I mean, that's it. We're told somewhere, and again, it's that othering piece. Oh, they are like this. They're dangerous. They're lazy. They abuse drugs. They do all this stuff. They. When at least my reality is, these are people in our community who haven't had all the opportunities. Like, I literally wake up every day and am thankful for the things you just mentioned, that it's warm, that I have a place, that I have a family. I'm very thankful for all that because I know there's lots of folks who don't. And it's not their, like, I mean, we seem to get hung up on whose fault it is. It just is. And unfortunately it is, because we as a society have kind of prioritized certain things over others. We have the wealth. We could provide opportunities for everyone. Like, we geez, I heard a number. So if we talk very specifically about folks with substance use disorder, the best data right now is that only about 10% of people in our state who either have a diagnosed substance use disorder or likely do, only about 10% of those folks get treatment. We also know that about half the people with a mental health condition get some sort of treatment, but a lot of times that's just talking to my primary care doc. So we have a very significant gap in the resources that people need and the resources they have available. And then, I mean, and then in my mind, like the number of people experiencing homelessness who probably need a more specific like they probably need a housing voucher and a place to be and some income augmentation, benefits or whatever. It's probably a couple thousand people a year. And we can't support that. Like that boggles me a little bit, because we're building $2,000 and $3,000 and $4,000 a month apartments everywhere. And that's got to be kind of a slap to folks too. I'm on the street and I've had lots of trauma, and I'm on the streets I've been on for a couple of years, and I'm seeing all these just huge apartment buildings going up, and I know that none of that's for me.
Yeah.
That's hard. That's just another kick. So I'm gonna I feel like I'm in kind of a spot. I wanna give folks a couple of things I want them to think about.
Okay, please do.
So we've talked about a bunch of stuff today, and hopefully one of the things that folks can get from this is that there is people are people. If we see them, they're members of our community, and regardless of their situation, their lot in life, et cetera, they're people. They have stories, and frankly, we're probably not as far away from some of that as we would like to be, in terms of I know lawyers, doctors, pharmacists, architects who are homeless, who are no longer practicing their professions for whatever reason because of one thing or another. It happens to everyone. So these are people. They're not they're people, and they're in our communities. And so to the extent that people can get involved, there's lots of volunteer opportunities. I think a great one is serving a meal at a resource center, because you get to talk to people and you get to experience the thankfulness. I've never heard so many thank you when people are serving meals, and so that's a great way to do that. Donate stuff, et cetera, you can get involved in those ways, and there's lots of places that'll allow you to do that. But then the other piece is, in general, let's think about saying yes more, because I swear to God, it makes things easier. When my staff finally understood that a little bit at the Youth Resource Center, they were like, wow, this is actually easier, because I'm not always saying no. Saying yes is easier. And I gotta say, I'm hoping folks start to realize that, because we hear no an awful lot. We hear no in our laws, and we hear no really from our leaders in many cases. And if we can just start saying yes a bit more, I think it makes a difference. And you said it too, like that person hears a yes and they're like, wait, that's different. That feels better to me. Because yes means I'm worthy, and no means I'm not worthy, to break it down in its simplest form. So that's what I would ask folks to think about. These are members of our community. And when you can, say yes.
I love it. This has been an amazing show. The conversation that we've had, Rob, has just been amazing, and thank you for sharing the stories that you've had and your experiences as well. Right, you live it on a daily basis, and you see really what's happening live every
Yeah.
single day out there. And I tip my hat off to you, the organization and all the staff that's there to do their best to say
Yeah.
yes and to
Yeah.
help individuals that are struggling. Because, you know, and I love what you just said too about doctors, attorneys, pharmacists and stuff who fell into whatever it was that changed their life. It can happen to any one of us at any time, right? We could get in an accident that does something to us and change the whole way we see life, and or something tragic could happen to us that
Yeah.
does something, so we're not immune. None of us are immune to it. None of
Yeah.
us at all. And hopefully our listeners, and I think the majority of the people who listen to this show, the individuals that listen to the show, understand this, right?
Yeah.
However, as long as we're out there spreading the word more, I want to make sure that I have NAMI's information also on the
Yeah.
show notes, so it'll be there, and I can
Okay.
make sure that Tina has all that. That share just a little bit more, real quick here
Yeah. Yeah.
about NAMI, about all the
Yeah.
stuff and the resources that you guys have.
Yeah. So I think one of the places we fit. So we have support groups. We have family support groups for family members of individuals with mental health conditions, because you find yourself alone a lot of the time. If I have a child with a mental health condition, the neighbors don't make me casseroles and come over and ask me how they're doing. And so we provide family support groups. We provide um, peer support groups. So if I'm a person with a mental health condition, I also feel pretty alone a lot of the times. And so we have those support groups, and they're all free of charge to participants, 6 days a week for those, and you can find all that on the website. Right now, most things are virtual because folks have really gravitated to being not having to drive. A lot of the folks that we work with have, they have transportation issues, or they live like we have a lot of folks that participate in support groups that are in rural communities where there's not enough neighbors to even do a support group. And so a lot of that's available virtually on our website. And the other thing we do is we have a support line. So just during the week, business hours, Monday through Friday, you can call and talk about anything, and there's no time limit, and there's no, and you can just talk. Like, we have lots of folks who call and there's like, I just don't know what to do. I don't know where to start. I don't know how I'm supposed to feel. I was told this or whatever. And we have both family and peer support folks who answer the calls, and you can just talk and get a feel for, if I don't know where to start, if I'm a family member and my young person is seemingly having some issues, we can help you get started. We can help you sort through, and we can give you some education. And then along with that, the other thing we do is we do actual education classes. They're usually like 8 weeks, one night a week. And you can really get into, what are these mental health conditions? What is my loved one experiencing? And because you don't get that when you go to the doctor. And like, if I have a kid, especially if the kid's over 18, I'm not getting anything from the clinicians. Like, half the time they won't even tell me what's going on. And so we can provide that support as well. Like, hey, here's what may be going on, or here's how you can get a little bit of additional information, et cetera. So we just want to support folks in their journey and help them not feel alone. We do help try and break the stigma. And for what it's worth, if nothing else, there are more conversations happening in our community, legislatively, et cetera, about mental health conditions. They're not always directed as appropriately as we would like, and that's why we also are up there with, USARA and Clean Slate and all those folks, poking at people, really just trying to educate and letting them know that saying yes with support and resources and opportunities is a heck of a lot better than saying no with law enforcement and other things. So yeah, we kind of like to think, if you're in a mental health situation, whatever it may be, and you just don't know what to do, where to turn, or if you just need someone to actually listen to you, that's what NAMI is here for. because we will listen.
Rob, I wish I would have known you about NAMI when my ex-wife was going through her battle with addiction, because I
Yeah.
was in a pretty tough spot.
Yeah.
And I'm not knocking this, because this organization has helped a lot of people. Al-Anon it wasn't a fit for me.
Okay. Fair
I
enough.
went to 3 classes. In that
Yeah.
3rd class, I said I'd never step foot in another one again, and I haven't,
Okay.
right?
Okay. Yeah.
It would have been nice, because I was losing my mind, I felt
Yeah.
like, right?
Yeah.
And it would have been nice to know of a place like NAMI, where I
Yeah.
possibly could have called, at least to talk to somebody, right?
Yep.
Because I kept it from family and friends for a long time. And it would have been nice
Yeah.
to known about you guys, and because I would have used your services, I'm sure of it.
Well, that's why we're here now, right? Like a
Yeah,
lot of what we do is spreading the word, because until you need us, you often don't know about us. And so, we're at community functions, we talk with employers, we go to, like I mentioned, community events and tabling, and we spread the word that way. And we do media stuff once in a while. We've got a walk, the NAMI walk, coming up on
yeah.
May 18th. There's the information on our website about that. So, we want folks to hopefully have access to the resources that we can provide. So again, it's why we do things like this, because you help spread the word. So we appreciate that.
Well, I've got your walk in my calendar.
Awesome.
So I ran into
Cool.
Tina up at the state capitol
Yep.
during the Walk to Remember, and she gave me some of the flyers. So, and it's at the Veterans Memorial, which is not too far from where I live.
Oh, excellent.
Yeah, yeah. Well, Rob, thank you, buddy, for so much for your time, and just don't take off when we stop, but
Okay.
just hang on for a minute. But again, thank you for all your time, man. I greatly appreciate it, and for all
Thanks
the
for having me.
information. Again, thank you for what your whole organization does.
Thank you. Thanks for having me.
Absolutely. Guys, again, thank you for all your support, all our guests, past guests, my gosh, past sponsors, and especially to all you listeners, man. Thank you so much. We're here in March, and March is actually here in about another week, actually 3 years that we've been doing this show. It's hard to believe that 3 years has gone by this quick. I would have never ever thought that when I started doing this, that this would still be going, and it's all because of you guys. So I have to say thank you for all your love and blessings. And remember this, addiction is giving up everything for one thing, and recovery is giving up one thing for everything. We're out.